Hello and welcome back to another insightful episode of MedSynapse podcast series. I'm your host, Hetvisha, and today we're diving into life after operating room. Specifically, what recovery really looks like following prostate cancer surgery. From pain control to pelvic floor rehab and the game changing role of robotics, we'll decode every milestone so clinicians can optimize care and patients can reclaim their quality of life faster. And joining us is Dr. Dharmender Aggarwal, an internationally trained robotic urology surgeon who has performed more than 700 robotic cancer surgeries and has helped launch robotic programs across India. He's certified by both the European Robotic Urology Section and ORSI Belgium. And Dr. Aggarwal brings frontline insights from London's St. George NHS Hospital to leading centers back home. So, welcome, Doctor, and it is such a pleasure to have you here.
Same here, Hetvi. I'm very glad to be here.
Same here, Doctor. So, Doctor, to kick off things, could you walk us through the immediate post-operative phase after prostate cancer surgery and what key milestones should clinicians monitor in those first critical days?
So understand this thing that robotic surgery, the prostate cancer surgery is nowadays being done with the help of robotics or minimally invasive techniques. And when we do any minimally invasive surgery, we expect the recovery to be very fast and very smooth. So in most of the cases, in more than 95% of the cases, the patient starts walking within 8 to 10 hours after the surgery. And that is what we should aim for. We should try to mobilize the patient as early as possible. We don't want them to be bound to the bed. We don't want them to be stuck to one position. We want them to be active. We want them to be walking around. So that is very important. So that plays a vital role in overall recovery for the patient, overall fast recovery of the patient. Second thing, we want very good anesthesia, very good pain control, because if your patient is in pain, he is not going to be able to walk. So we want him to be completely pain-free as much as possible, so that he can comfortably go around the ward, go around outside his room and walk around. So that is very important. We focus on complete pain control. Pain is anyway less with the help of minimally invasive surgery because the cuts in the skin, the cuts in the abdomen are very small in the size. But even with them, we want it to be completely pain-free and we want them to be mobile as early as possible.
Absolutely. And I think that checklist actually really clarifies early stage priorities also. So, Dr. Now, from a surgical perspective, how do outcomes vary between, open, laparoscopic and robotic prostatectomies and in terms of especially recovery time and complication rates?
So that's a very long contested question between the open surgery and the minimally invasive surgery.
Right.
So the open surgery is a traditional outlook. It's where we give a very big incision. The access into the pelvic area of the abdomen is very difficult. It is very difficult to suture it properly. We do not get good magnification. We are not able to perform minor alterations in the anatomical landmarks. So that is very important. When we compare it to the laparoscopic surgery and especially robotic surgery, which is a mainstay of the minimally invasive surgery for pelvic areas nowadays. So robotic surgery has a good magnification. It helps us to dissect around the prostate and it helps us to preserve the neurovascular bundles around the prostate. So when we preserve these neurovascular bundles, that helps in the early recovery of the erectile function of the patient, which is very important for most of our patients. And it helps in the early recovery of the urinary continence for the patients, because with the traditional open surgery, it has been noticed that patient used to have a long duration of urinary incontinence and sometimes even more than 1 year of urinary incontinence. When we compare it to the robotic surgery, the functional recovery is very fast. They are on their legs, on their foot, walking within a few hours of surgery. Even in the long-term recovery, the urinary incontinence is tackled very fast. So patient, they get diaper-free or pads-free as early as 1 to 2 weeks after surgery, if the surgery is performed meticulously and if it is performed by keeping this in mind that we have to preserve maximum structures around the prostate.
Correct. I think that's so interesting to know. So now, doctor, for listeners, who is new to this concept, what exactly is robotic surgery and how does it accelerate overall recovery, especially early continence, and what cutting-edge robotic methods are further boosting post-op urinary control?
So robotic surgery is not done by robot. That's the most important part. It is done by a surgeon. So what we do is robotic surgery allows us to put small cuts in the skin. The instruments goes inside the body. It's very much similar in concept to the laparoscopic surgery. Because of the good magnification, we focus only on the prostate. We preserve the nerves around the prostate. Because of the good pneumoperitoneum, there is a very minimal blood loss. 99% of the times we do not need any blood transfusion. The blood transfusion rate is barely 1% in the robotic surgery for the prostate cancers. So the patient doesn't need blood transfusion. There is no blood loss. The catabolism of the body is very minimal, and that helps in the faster recovery. We preserve the fascias around the prostate. We apply some new techniques of robotic surgery also to preserve the structures around the prostate, which is endopelvic fascia, muscles, pelvic diaphragm muscles, and all of these muscles, they help us in getting a good control of urine after the surgery. So they helps us in getting a good continence after the surgery. We preserve the external urethral sphincter. We preserve the internal urethral sphincter in the form of bladder neck. So all of these things, they all contribute again to the faster recovery in terms of continence as well as erection. And definitely with the low catabolism, it helps in the early recovery of faster diet, faster discharge from the hospital, early recovery of the bowel functions, and all these things.
So overall, it is actually very beneficial for post-op also, I would say.
It is one of the landmark treatment for the prostate cancer patients, because before the advancements of the robotic surgeries, most of the people, not only the patients, even the doctors would get scared of doing the radical prostatectomy surgeries, because they knew that even if they got rid of the cancer, the functional outcomes are not going to be great. But and many of the times people used to promote the patients to go for radiation and hormone therapies. When we compare this era to the current scenarios of robotic surgeries, we are focusing more and more on the surgical excision of the diseases now, because now we are able to give very good functional results with a complete surgical excision of the disease.
Yeah, I think that's really interesting to know. Now, doctor, let's pivot to rehab. What role does pelvic floor physiotherapy play in speeding recovery, and when should clinicians actually initiate it?
So when we talk about the pelvic floor rehab or pelvic floor recovery, what this all rehab actually starts far before the surgery. So most of the times when we see the patients in preoperative time, we teach them some pelvic floor exercises, which are a modified version of Kegels exercises. And these exercises get an idea to the patient that they have to continuously do the strengthening exercises for their pelvic floor muscles. Once we do the surgery, the catheter is going to be in there, and most of the time this catheter is in there for a week, so about 7 to 8 days. Once we remove this catheter, patients are asked again to restart their pelvic floor muscle exercises as early as possible. And in my personal practice, I would recommend patients to start doing these exercises at least 4 to 5 times daily, not once or twice, at least 4 to 5 times daily. They can just do it while sitting in the chair, reading a newspaper, lying down on the bed. During their routine activities, no one need to know, no one need to understand that they are doing this exercise, but they can just simply keep on repeating it. And with these regular exercises, we feel that the pelvic floor muscles, they get stimulated, they get strengthened, and they helps us a lot in getting this patients pads free very soon.
Yeah, I think these little changes are also a milestone. Can go a milestone also, and I think those are great takeaways that can be taken. So now, doctor, in your experience, how vital is psychological support and patient counseling after surgery? Strategies have you found most effective? Because psychologically, it is not much spoken, but it is really needed.
See, the diagnosis of cancer is itself a biggest stress on the patient's head. And
Correct.
once, as a clinician, you are giving this diagnosis to the patient, you have to understand that this is the first time, maybe most likely this is the first time patient is hearing this word, and he has to absorb this news. So you cannot just load them with all the information all at once. That is the most important part. You have to give them the information, but at the same time, you have to give them the hope that there is a complete cure or a complete treatment available. You have to take them through the journey of how the surgeries is going to be done, how the treatment is going to be done, what treatment you will need after surgery, what treatment you won't need after surgery. And also, my special feeling is never hide anything from the patient. Never hide any complication or progress charts from the patient. Tell them in advance that this is something which happens in this much percentage of cases. This thing will recover in 12 hours, this thing will recover in 10 days, this thing will recover in 3 weeks, this thing will recover in 2 3 months. So teach them, tell them everything. Maybe sometimes people get benefited by talking to the patients who has undergone these similar experiences. So we try to keep a catalog of all our previous patients, and we give the options to all the patients that they can contact these previous patients, and that can help them to understand how the recovery is actually going to be. And when someone speaks to a person who has gone through exactly those phases, they are able to correlate it better, and they are able to take this information in their mind more positively. Also, we try to involve our specialized nurses, which are very much trained in these cancer counselings and these post-operative counselings. And these specialized nurses, they again form a support structure for these special patients, and that helps in overall tackling this word cancer.
Yeah, actually, and I think maintaining trust and communication among patients and healthcare professionals is really important during this tough time, even for the patients too.
No doubt, that's very important.
Yeah. So now, Doctor, finally, with enhanced recovery after surgery or ERAS protocols gaining traction in urologic oncology, how have these pathways impacted outcomes following prostatectomy?
So, as I mentioned from the very beginning, we follow ERAS protocol very strictly. So, the first and foremost part is complete pain-free experience. We want the patients to be completely pain-free. We use different levels of analgesics for that purpose. We want them out of the bed as early as possible, and we allow their diet within 12 to 16 hours after the surgery. So we don't wait for a 24-hour stay. We as soon as the surgery is done, we have started coming out from the bed. We allow the patients their basic, at least a liquid diet, and that will help the patient in to get their gut motility back in. That helps the patient to feel normal after the surgery. The walking helps in that, and all of these things, they contribute towards the ERAS protocol. Now, this ERAS protocol is not only valid for robotic prostate surgeries, it is equally valid for kidney cancer surgeries, urinary bladder cancer surgeries, and all other major surgical procedures. Definitely, minimally invasive technique helps us a lot, because if we try to perform this ERAS protocol in a open surgery kind of scenarios, it is going to be very difficult. But for the minimally invasive scenarios, we are able to use these protocols for almost all oncological procedures.
Correct, correct. I think these innovative evidence-based sound like the future standard also. Dr. As we wrap up today's session, thank you so much for actually translating complex science into clear practical tips. So thank you so much for sharing that.
Thank you, AP. It was nice speaking to you.
Same here, Dr. And to our audience, thank you for tuning into yet another insightful episode of MedSynapse podcast series. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, keep learning and keep healing.